The ER doors flew open. Doctors rushed in with a stretcher. A man in a black suit, skin pale as marble, eyes half open, gasping. "That's Marcus Sterling," someone whispered. "The tech billionaire. The man who built half of Silicon Valley." The lead surgeon barked orders. "Stage 4 cardiac arrest. Crash cart now." Nurses scrambled. The defibrillator charged. Shock after shock. Nothing. The monitor flatlined. The room froze. But one nurse didn't move. Sarah Mitchell, 32, quiet, efficient, the kind of nurse who never made waves. She stood at the back of the trauma bay, studying the billionaire's face, the blue tint to his lips, the rigid tension in his jaw, the way his chest wasn't moving quite right. "This isn't cardiac arrest," she said quietly. The surgeon's head snapped up. "Excuse me? This isn't his heart." Nurse Mitchell stepped back. "You're not in charge here." But she wasn't listening. Her hands moved fast, reaching for a syringe on the tray, something the others hadn't even looked at. "Stop!" the resident shouted. "What are you doing? You'll kill him!" Sarah's voice cut through the panic, calm and steady. "Trust me." For 3 seconds, nothing happened. Then the monitor flickered. One beep, then another. A pulse. Weak, but real. The billionaire's chest rose. Air filled his lungs. The room went dead silent. The lead surgeon stared, speechless. What did you just do?" Sarah didn't look up. Her hands were still moving, steady and sure. "Just something I learned a long time ago." The night had started like any other at Mercy General Hospital. The emergency department hummed with its usual chaos. Broken bones, chest pains, the occasional drunk driver who thought he could still walk a straight line. Sarah Mitchell moved through it all like water, smooth, efficient, invisible. She'd been at Mercy General for 18 months. In that time, she'd earned exactly one reputation: competent, not brilliant, not remarkable, just competent, which was exactly how she wanted it. Her dark hair was always pulled back in a neat ponytail. Her scrubs were always pressed. Her smile was always polite, but distant. She clocked in at 7, clocked out at 7, never stayed late, never volunteered for extra shifts. The other nurses thought she was boring. They had no idea. Sarah was at the nurses' station, updating patient charts on the computer, when the call came in. "Mercy General, this is dispatch. We have a critical inbound. Male, mid-40s, unresponsive. Possible cardiac arrest. Patient is a VIP. Security is requesting immediate trauma bay clearance." Linda, the charge nurse, looked up sharply. "VIP? Who?" The dispatcher's voice crackled. "They're not saying, but they're sending 6 units. ETA 3 minutes. 6 ambulances." Sarah's fingers paused on the keyboard. 6 units wasn't normal. 6 units meant power, money, someone who mattered. Dr. Richardson, the trauma chief, was already moving. Tall, 50, silver hair, the kind of doctor who'd seen everything and wasn't impressed by anything. "Clear Trauma 1, he ordered. "I want a full team, cardiac specialists on standby, and someone get me the patient's medical history the second we have a name." The ER erupted into controlled chaos. Sarah stood slowly. Something in her chest tightened, a feeling she hadn't felt in years. She followed the team toward the trauma bay, not because she was assigned, but because something told her to. The ambulance bay doors exploded open at 11:47 p.m. 6 paramedics burst through, pushing a stretcher at a dead run. On it lay a man in a black designer suit, 46 years old, 6'2", athletic build. His face was grey, his lips were blue, his eyes were half open, staring at nothing. "This is Marcus Sterling," the lead paramedic shouted. "Tech CEO, collapsed during a charity gala at the Paramount Hotel. Witnessed arrest. We've been doing CPR for 12 minutes, 3 rounds of epi, 2 shocks. No response." Someone in the back of the room gasped. "Marcus Sterling!" The Marcus Sterling. Sarah's hands went cold. She knew that name. Everyone in America knew that name. Marcus Sterling, founder of Sterling Tech. Net worth, $43 billion. The man who'd revolutionized artificial intelligence. The man whose software ran in 80% of the world's smartphones. The man whose face was on the cover of Time magazine last month with the headline, "The Man Who Will Change Tomorrow." And now he was dying on a stretcher in front of her. Dr. Richardson didn't waste time. "Get him on the table. Now, I want full vitals, a 12-lead EKG, and someone call cardiology." They transferred Sterling with practiced efficiency. His suit jacket was ripped open, shirt torn away, his chest was pale and still. An oxygen mask was strapped over his face. 4 lines went into both arms. The defibrillator paddles were ready. "BP is 60/30 and dropping," a nurse called out. "Pupils fixed and dilated," another said. Dr. Richardson positioned himself at the head of the table. His face was grim. "He's been down too long. Brain damage is likely even if we get him back." "Should we keep trying?" a resident asked quietly. "We try until I say stop." The defibrillator charged with a high-pitched whine. "Clear!" Sterling's body jerked. The line on the monitor spiked, then flattened. Again. 300. Another shock. Another flat line. "Push another round of epi." A nurse injected medication into the IV. Nothing. The monitor's tone was flat, steady, the sound of death. Dr. Richardson checked his watch. 13 minutes since collapse. His jaw tightened. "One more round. If we don't get anything, we call it." The room held its breath. The defibrillator charged again. "Clear!" Shock, flatline, silence. Dr. Richardson pulled off his gloves. His shoulders sagged. Time of death, 11:54 p.m. The room went still. A nurse reached up to silence the monitor's alarm. The sudden quiet was worse than the noise. Another nurse began disconnecting the IVS. A resident stepped back, pulling off his gown. Life moved on, the way it always does. But at the back of the trauma bay, Sarah Mitchell stood frozen. She stared at Marcus Sterling's face, at his grey skin, at the blue tint around his mouth, at the way his jaw was locked, rigid, too rigid. Her mind raced back. Years ago, another hospital, another country, another life. She'd seen this before. "Doctor," she said. Her voice was quiet, but something in her tone made Dr. Richardson turn. "Nurse Mitchell, I need you to help prepare the body for—" "This isn't cardiac arrest." The room went silent. Every head turned toward her. Dr. Richardson frowned. "Excuse me?" Sarah stepped forward. Her eyes were locked on Sterling's face. "Look at his jaw. The muscle rigidity. The cyanosis pattern. This isn't his heart." "Nurse, I've been doing this for 30 years. It's his airway." Dr. Richardson's frown deepened. "His airway is clear." We checked. Not an obstruction. Sarah moved closer to the table. Her hands were steady. Her voice was calm. "Look at the way his chest isn't expanding properly. The intercostal retraction, the jugular vein distension." She pointed at Sterling's neck. There was a subtle swelling, easy to miss in the chaos. "Tension, pneumothorax," she said. The room went dead silent. Dr. Richardson stared at her. "That's impossible. We would have seen it on exam." "Not if it developed during resuscitation. Broken rib from CPR, punctured lung, air building up in the pleural space, compressing the heart. That's why the shocks didn't work. It's not the heart. It's the pressure." A resident spoke up nervously. But he's been flatlined for 3 minutes. Even if you're right, it's too late." Sarah didn't answer. She was already moving. Her hands reached for the equipment tray. "Nurse Mitchell, step back," Dr. Richardson said firmly. "You're not authorized to—" She grabbed a large bore needle, 14 gauge, the kind used for emergency chest decompression. "What are you doing?" the resident shouted. "You'll kill him." Sarah's eyes met Dr. Richardson's. For the first time, he saw something in her expression that didn't belong on a quiet ER nurse's face. Something hard, trained, military. "Trust me," she said. For one long moment, no one moved. Then Dr. Richardson nodded. "Do it." Sarah positioned the needle above Sterling's second rib, right side, mid-clavicular line, the exact spot where trapped air would be crushing his heart and lungs. She didn't hesitate. The needle went in. For 3 seconds, nothing happened. Then, a hiss of air, high-pressure air escaping. Sarah felt it, the resistance, the release. Sterling's chest suddenly expanded. Not much, but enough. "Bag him," she ordered. Her voice had changed, no longer quiet, commanding. "Now." A nurse grabbed the oxygen bag and squeezed. Once, twice. The monitor flickered. One beep. Silence, then another beep. The line jumped. "Oh my God," someone whispered. Sterling's chest rose, not from the bag, on its own. The monitor beeped again. Steady, weak, but real. 40 beats per minute. 50. 60. "We have a pulse!" the resident shouted. The trauma bay exploded. Nurses rushed back in. Dr. Richardson grabbed Sterling's wrist, feeling for the pulse himself. It was there. Faint, thready, but there. "Get him to CT," Dr. Richardson barked. "I want a full scan, chest, head, everything, and prep the OR. He's going to need a chest tube." The team moved like a machine. Within 90 seconds, Sterling was being wheeled toward imaging. As the stretcher passed Sarah, Dr. Richardson caught her arm. "Where did you learn that?" he asked quietly. Sarah met his eyes. "A long time ago. Another hospital." "What hospital?" She didn't answer. Dr. Richardson studied her face. For the first time, he really looked at her, at the way she stood, the calm in her eyes, the steadiness of her hands. "You're not just a nurse, are you?" Sarah smiled faintly. Marcus Sterling woke up 2 days later in the ICU. The first thing he saw was white ceiling tiles. The second thing was tubes. 4 lines, a breathing tube down his throat, and pain. God, the pain in his chest. A nurse appeared, young, blonde, smiled when she saw his eyes open. "Mr. Sterling, welcome back. I'm going to call the doctor." He tried to speak, couldn't. The breathing tube prevented it. She squeezed his hand. "You're okay. You're at Mercy General. You've been unconscious for 2 days. You had a cardiac event, but you're stable now. Cardiac event. That's what they were calling it." He didn't remember much. The gala, the speech, standing at the podium, then pain, pressure, falling, nothing after that. Dr. Richardson arrived 10 minutes later, tall, silver-haired, professional smile. "Mr. Sterling, good to have you back. You gave us quite a scare." They extubated him an hour later. The tube came out and Sterling could finally breathe on his own. And speak. "What happened?" His voice was rough, raw. Dr. Richardson sat down beside the bed. "You collapsed during your speech. Cardiac arrest. We did CPR for nearly 15 minutes. You were clinically dead." Sterling absorbed that. Dead. He'd been dead. "But you brought me back." "Not me." Dr. Richardson's expression shifted. "One of our nurses. She recognized something the rest of us missed. Saved your life." "What nurse?" "Sarah Mitchell." The name meant nothing to Sterling. "I want to thank her. She's hard to find." Dr. Richardson's tone was careful. "She doesn't like attention. I don't care what she likes. She saved my life. I want to talk to her." It took 3 days before they convinced Sarah to visit. She came during the evening shift, quiet hours, when most visitors had left. Sterling was sitting up in bed, reading news on a tablet. He looked better. Colour had returned to his face, but he moved carefully. The chest tube had come out yesterday, and every breath still hurt. There was a knock. "Come in." The door opened. A woman stepped inside. Dark hair, tired eyes, scrubs. "Mr. Sterling, I'm Sarah Mitchell." He studied her. 32, maybe 33, pretty in an understated way, but there was something else, something in the way she carried herself. "The nurse who saved my life." "I did my job." "Dr. Richardson says you did more than that. He says you diagnosed a tension pneumothorax after I'd been flatlined for 3 minutes, that you performed a needle decompression without authorization, that you basically brought me back from the dead. Sarah's expression didn't change. You weren't dead. You were in arrest. There's a difference. Most people don't know that difference. I'm not most people. Sterling smiled faintly. No, you're not. He gestured to a chair. Sit. Please. She hesitated, then sat, perched on the edge of the chair, ready to leave at any moment. How did you know? Sterling asked. Dr. Richardson said he didn't see it. None of the other staff saw it. But you did. How? Sarah was quiet for a long moment. I've seen it before. Where? A long time ago. That's not an answer. It's the only one I'm giving. They sat in silence. Finally, Sterling spoke. You're military, aren't you? Sarah's eyes snapped to his. I can tell, he continued. The way you stand, the way you speak, the way you made decisions under pressure. You weren't always a nurse. Sarah stood. I should go. Wait! Sterling's voice was sharp. Command. The voice of a man used to being obeyed. I owe you my life. I want to repay that debt. Name your price. I don't want your money. Then what do you want? Sarah turned at the door, looked back at him. I want you to forget my name. Forget my face, and never mention this to anyone. Sterling frowned. Why? Because some people don't want to be found. Her voice was soft. And some heroes don't want to be heroes. She left. Sterling stared at the closed door for a long time. Then he picked up his phone. It took Sterling's investigators 2 weeks to find the truth. Sarah Mitchell, born Sarah Martinez, enlisted in the army at 18, became a combat medic, deployed to Afghanistan, served in a forward operating base near Kandahar, and then promoted, sent to medical school, army scholarship, became a doctor, a surgeon, Captain Sarah Martinez, MD trauma surgeon, deployed again, this time as a doctor. In her third deployment, her convoy was hit. IED blast. 3 soldiers killed, 4 wounded, including her, medically discharged, honorable, Purple Heart, Bronze Star, and then nothing. She disappeared from public record, reappeared 2 years later. Different name, different life. Sarah Mitchell, nurse. No military record listed, no medical degree mentioned. Working night shifts in emergency rooms, staying quiet, staying hidden. Sterling read the file 3 times. Then he made a call. 1 month later, Sarah was called to the hospital administrator's office. She knew what it was about. She'd known since Sterling's investigators started asking questions. The administrator was a thin man with glasses, nervous. Nurse Mitchell, please sit. She sat. We've received a rather unusual request. He cleared his throat. From Marcus Sterling. Sarah said nothing. He's offering to fund a new trauma wing. $50 million, state-of-the-art equipment, research facilities. He wants to call it the Sterling Martinez Trauma Center. Sarah's jaw tightened. He also wants to offer you a position, Director of Trauma Services, full salary, benefits, autonomy to run the program however you see fit. No. The administrator blinked. Excuse me? No, I'm not taking it. Miss Mitchell, I'm a nurse. That's what I want to be. That's what I am. But you're a doctor. A surgeon. I was a surgeon. Sarah stood. Not anymore. She walked to the door. Why? The administrator called after her. Why give up everything you worked for? Sarah paused, hand on the doorknob. Because some things you can't come back from. Her voice was quiet. And some people don't deserve a second chance to play God. She left. But the next day, she found an envelope in her locker. Inside, a handwritten note. You gave me a second chance. Let me give you one. Not as a doctor, not as a soldier, just as someone who knows that healing doesn't require a title. It just requires courage. Thank you. MS. Below it, a check for $200,000 made out to the Sarah Mitchell Scholarship Fund for Combat Medics Transitioning to Civilian Medicine. Sarah stared at it for a long time. Then she smiled. Some debts, it seemed, couldn't be repaid, only paid forward. 6 months after Marcus Sterling's near-death experience, Mercy General Hospital opened its new trauma wing. The Sterling Martinez Trauma Center occupied the entire 4th floor. State-of-the-art equipment, advanced imaging, a dedicated team of specialists, and tucked away in a quiet corner office, a small plaque. In honor of Captain Sarah Martinez, MD, and all the silent heroes who serve without recognition. Sarah never attended the opening ceremony. She was working the night shift, as usual. But something had changed. The scholarship fund had processed its first applications. 12 combat medics, men and women who'd served their country and wanted to continue serving at home. Each one received full funding for nursing school, housing, living expenses, everything they needed to start over. Sarah reviewed each application personally. She knew their stories, their struggles, the weight they carried. She'd been there. One night, after a particularly difficult shift, a car accident, 2 trauma codes, 1 death, Sarah sat in the break room with a cup of cold coffee. Her phone buzzed, a text from an unknown number. Checked in on the scholarship recipients. All 12 are thriving. One just passed her first semester exams. Another started working at a VA hospital. You're changing lives, Sarah. Thank you for letting me be part of it. MS. Sarah smiled. She typed back, "They're changing their own lives. I'm just opening doors." A moment later, "Sometimes that's all a hero needs to do." Sarah put her phone down, looked out the window at the city lights. Somewhere out there, 12 people were building new lives, finding purpose, healing others while healing themselves, just like she had. The break room door opened. Linda, the charge nurse, poked her head in. "Sarah, we've got a trauma coming in. Multi-vehicle accident. They're asking for you." Sarah stood, straightened her scrubs, pulled her hair back. "On my way." As she walked toward the trauma bay, she felt it again. That feeling she'd been running from for so long. Purpose. Not the kind that came with rank or title or recognition. The quiet kind. The kind that didn't need a spotlight. The kind that saved lives in the dark and asked for nothing in return. She pushed through the trauma bay doors, ready, because some heroes wear scrubs instead of capes, and some courage doesn't need applause. It just needs to show up, every single day. If you believe the best heroes are the ones who never ask for recognition, share this story. Because every day, people like Sarah walk among us, saving lives, expecting nothing, and reminding us that courage doesn't need a spotlight. Comment "hidden hero" if you'd want someone like Sarah in your corner. Because the world needs more people who choose compassion over glory.